How's it going, everybody? I'm Jeff Slakey from iFiber1 KMAS, and I'm really happy to be a part again of the second night of our forum on the future. We're coming to you now from North Mason High School, where we're going to have some more great representatives talking about the future of Washington State, Mason County, as we move forward past the reopening here at the beginning of the month. We've got more really great guests to talk with us here tonight. Going to be on the panel, Dr. Ren Hudgens, who's on the Behavioral Health Strike Team for Washington's Department of Health, Scott Lindquist, the Washington State Department of Health, also Dave Windom from Mason County, the Director of Mason County Community Services. Lynette Bird will check in, the Clinical Operations Director from Peninsula Community Health Services. Also Lynn Eaton and Diane Hennessy from Mason PUD number 3. And Todd Parker, who's in the Housing and Mental Health Program Coordinator for Mason County Public Health. There will be some opportunities for you to ask questions both in the chat here and in person here at North Mason High School. Additionally, Dana Rosenbach will talk with us more from the North Mason School District perspective. So to get things started here, I'd like to welcome from Mason County Public Health, Health Director Dave Windom.
Okay, well, good afternoon, everyone. It's great to be here, and I'm really pleased. We put this forum together on an idea that came out about a month ago, and I really want to say thanks to our folks at the EDC who have been backing us up and getting all resources together, and Jeff, this is, I think, a great idea to bring the community together and have this out there for people to come back and reference again. So I'm going to give a little brief back on the past year and then kind of look forward a little bit. So let's see here if I can. Am I sharing screen here? So I was looking for the slides. Okay. Oh, they're here. Okay. There we go. Forum slides. Okay. Are we seeing that? Okay, super. Okay, so let's go back in time in Mason County to February of 2020. We got our first case, and public health stood up our emergency management team. And very shortly after that, within a week, we decided this is going to be way bigger than what we can handle, but just within the confines of public health emergency management. So we opened up area command, and that gives us the ability to bring in all these other resources. So we brought in the sheriff's office, the hospital, the health clinics, EDC. So even on day one, we started thinking about recovery. So even after this is over, how do we start recovering? We started that on the day one process, and we brought in all these resources. And that's been going very well ever since. So at first we were meeting every day, and then we went to 3 days a week, and now we're down to about once a week as this starts to taper off. So if you look at the slide, you'll see that we've had our first bump there in April of 2020. And this slide is the rates per 100,000. So if you think of rates per 100,000 as the speed, how fast the virus will transmit and go through the community, you see we started off very, very low. April came up just a little bit, and then we kind of went back down again. So during that time period between April and July, if you remember, we were doing the phased approach to recovery. So we came out of lockdown from phase 1 to phase 2. We had plans that we would submit to DOH, and the Secretary of Health would approve those. And we did phase 1 to 2, phase 2 to 3, and then July hit. So you see July started to shoot up. And at that time we thought, wow, this is really a big peak, not knowing, of course, what was coming next. So July peaked into early August, and then it came back down. But if you look at the rates there, you'll see that when we hit our new plateau, it was higher than the previous plateau. So our baseline keeps coming up with each spike. We had a little bit of a spike in October, and then it came back down again, and then it went crazy really in November and December into January. Now, think of that also as our time when we typically have a lot of flu. What's interesting is that we didn't have flu that came with this. So the flu season just never arrived. And it was like that at a number of places. South America, they call it the year the flu never came. And that was the case here in Mason County as well. We just had very, very few hospitalizations with flu. I mean, almost none. And it was nothing like in 2018 when we were having to look for beds as far away as Portland to get people with influenza into beds. Didn't have that. What we did have is this big spike in COVID. So the rates increased in January, started to come down. They peaked up a little bit again, and then dropped back down in late February, early March. And again, you'll see that the rate was still higher. The baseline was still higher than it was on the peaks before. So, and then in April, started to creep back up again and almost hit the 200 cases per 100,000 mark. And now we're back down to about 59. Actually, we're in the mid 50s this week. So we're looking really good on the cases per 100,000. So if you think of cases per 100,000 as the speed, let's look at the actual cases. So it's very close. It mirrors it. These are actual numbers of cases. So you kind of, when you look at numbers, excuse me. Thanks, Scott. That's good. So if you look at the actual number of cases, you have to put things in perspective. You can look at percentages, and percentages will look big sometimes when the numbers are really fairly small. You know, if you have one case and then the next week you have two cases, well, your rate doubled, but it was only one more case. So you just kind of have to put things in perspective. So look at the numbers from both sides of the spectrum. And then you'll see we had one day with just a huge spike of cases there in December. And that's when a lot of the data caught up to us that had not been allocated to the county, finally showed up in our county books all in one day, boom, huge number of cases, but it really wasn't that many cases on that day. So we had the correction system cases all got added to us on that day, and we had all these other data pieces that caught up, and that's why we had that big spike. So January, again, peak, second peak, and then came back down. So now we're back again in April, May, June, July. And what I see going forward, I really kind of want to talk about where we're headed from here, I think. So we have the new variants coming out. So the initial virus that we had that was active through most of the year has been replaced by what's called the Delta variant. So the Delta variant is out there. The wild virus we had at the beginning is it's a very small percentage of what we're seeing now. So we're probably going to see these variants continuing for some time, but we do see it, you know, trailing off, and I see that continuing hopefully in the future. I am concerned with some things we've seen recently. We are seeing more children under the age of 12. In the last month, we've had 7 kids under 12 who are actually sick with COVID. And they got that through family relationships, not through other kids or through schools or anything. So through families. And that's a little bit concerning because we hadn't seen kids that young getting sick before. And we're also starting to see cases of what we'll call reinfection. So people who had COVID a year ago, they got sick, they garnered some, natural immunity to COVID, but now they're sick again. So it's a reinfection, and we're having those things genotyped so we can see if it's a new variant, probably is, and just kind of, wrapping a little bit of science around that, try to get an understanding what's going on. I am concerned that as we come down, that the flu season may hit us this year with influenza A and influenza B, typically in the fall when kids go back to school. And as we come out of the social distancing and masking requirements, I think we'll see more flu being transmitted this fall. But this virus has been tricky. It has not adhered to what we had expected all along. I thought for sure this was going to be seasonal, and there's been just no seasonality to it. It seems to hit every quarter, seem to have a spike. So that will be interesting going forward to see what happens there. If we continue to see that the cases come down, I think we'll see it reassessed from being a pandemic to being endemic. So endemics like the flu or colds or things, it's just going to be in the system and something we'll have to deal with as we go forward in time. And it's, like I said, this is interesting. We apply the science. We're learning new stuff about this virus all the time, and then it does keep changing. And we have with us this afternoon Scott Lindquist, who will talk about the variants a little bit. And I think with that, Jeff, I will move on.
Yeah, all right. So the next speaker that will join us here on this Zoom call will be Dr. Ren Hudgens, who is a behavioral health strike team for Washington's Department of Health. Dr. Hudgens, are you there?
I am here. Can you hear me?
Yes, we can.
Okay. All right. Next step is if you can see my screen. Let's see if this works.
Yep, we sure can.
Okay, thanks very much. Um, so, good evening, everybody. I'm a twice retired psychologist, twice retired from being paid, 20-year Red Cross disaster mental health responder. And when the pandemic hit, I went back to work for the Department of Health, King County Public Health, Medical Reserve Corps of Issaquah, Medical Reserve Corps of Vashon Island. So I'm full-time back to work, but it's all community service. So happy to contribute. This is a graph of how a disaster sort of plays out psychologically. We've got, if you follow the yellow line, we've got the impact over here. That was March, a year and 3 months ago. Then we get the honeymoon phase. That's the community cohesion. We're all in this together. We got this. And then at some point we realize what we're in for, and we start down the disillusionment slide right here. We start to get symptoms, mild depression, anxiety, increasing as we get further down. There are a lot of cognitive symptoms in here. We don't focus as well as we used to. We don't concentrate as well as we used to. We walk into a room and wonder why we came there. We get down to the bottom of the disillusionment trough here, and that's when we expect to see the most severe psychological impacts, the worst depression, anxiety, substance use, elder abuse, domestic abuse, child abuse, all of that. So here we are, about month 15 or so. The months are down on the bottom horizontal axis. And you see two different trajectories for a recovery path. And you've got the yellow line, which is more favorable, rises faster, and you've got the dotted line. So one question you might reasonably ask is, who's going to be on which trajectory? Who's going to be on the dotted line? Well, there's some populations we suspect will be on the dotted line and recover more slowly. And those some of those would be those who experienced both the primary and the secondary effects of the pandemic. That is, primary, they had a family member that was infected, maybe died, and then after that they lost their job or they lost their home. So that's a primary and a secondary effect. So those folks, and then we have the wildfires. There are people that were infected, lost somebody, and then there was a wildfire and they lost their home that way. So those folks are likely to be on the lower dotted line. We call that a trauma cascade, by the way, when you get knocked down off your feet by one trauma and you're not quite back up on your feet and you get knocked down by another one. Other populations, LGBTQ will be down here. BIPOC populations are likely to be down here. The other group that could be down here would be counties in the state of Washington with low vaccination rates, given how fast the Delta variant is screaming through the unvaccinated populations. Those counties, a lot of them in eastern Washington, could be closer to this dotted line. Okay, let's move on. I'm not going to read all this slide to you. I'm just going to tell you what I think the most important parts of it are. What's been true for us for a long time, most of the last 14 months, is that we're in an extended fight or flight reaction, and so we have a lot of stress hormones that have been released into our brains, and normally those stress hormones only are released for short periods of time, the amount of time it takes to outrun the bear, for example. But unfortunately, those stress hormones have been running around in our brain for 14 months, and it produces some undesirable effects. So we are more impulsive right now than we usually are, and we're more emotional, and we're experiencing a wider range of emotions. So that's been true for a long time. But you add to that what's new, and what's new is that we're opening up. And as we open up, people head back into uncertain situations. They head back maybe to a workplace. They don't know what the new rules are going to be. They head out to more social interactions. They don't know who's vaccinated and who's not. And whenever you have uncertainty, you have more anxiety. Uncertainty tends to spike anxiety. If you think about why a lot of people are afraid of the dark, it's not because of what we know the dark contains, it's because of what the dark might contain. It's the uncertainty of it all. So uncertainty spikes anxiety, and as we open up, we're heading into more uncertain situations. So let's see. I guess the other thing about the heading into uncertain situations would be, I noticed in myself that after I was completely vaccinated, I was still reluctant to go out into the world in situations where I safely could have. And so I think there are people that are more fearful, not reasonably because they have to be, but out of habit. And that was true for me. But as we open up and we go out into the world, we're going to be seeing more people. We're going out into a less masked world. So we will see people's reactions and we will be showing our own more as we go out there. So let's see, moving on. One thing we're worried about is an increase in risk-oriented behaviors in the warmer months coming up. There's a lot of pent-up energy out there, and it's gonna show itself. That's kind of what we're worried about. So we have the combination of opening up, summer months, a feeling of celebration in the minds of many. But we see really, and we still have this impulsive side to us more than usual. And so we see things like in New York City, they had 26 shootings last weekend alone, which is double what they had a year ago the same weekend. So we are concerned about an increase in impulsive and not very thought through behavior. There are also some brand new behavioral health diagnoses associated with COVID-19. We continue to see a lot of depression and anxiety. I've got a slide on that coming up. But post-COVID-19 psychosis is a new diagnosis. And then there's been an increase in dementia for adults over 65, 14 to 90 days after a COVID diagnosis. So here I've got a graph. This is statewide data here. I've got some Mason County specific data coming up. But if you just look at this, the blue line is anxiety, and it's on the vertical axis. You see that most of the blue line is contained between 1.5 million and 2 million people in the state of Washington. And we have 7.6 million in the state of Washington. And so what that means is that the level of significant anxiety among Washingtonians right now is 21 to 26%. So that's 1 out of 5 or 1 out of 4. That's a very high level of anxiety. Likewise, the yellow line, depression, that if you look at it globally, most of it is between 1 and 1.5 million. So that's 13% to 20% of the population in Washington. So that's a lot of people also. If you look at the two peaks in those lines, the peaks in the blue line correspond to the peaks in the yellow line, and they correspond to our social unrest last summer, the peak of last summer, end of June there, and the peak on the right corresponds to all the stuff we had going on around the inauguration day events at the Capitol. The good news, there is good news here. If you look at the last month over on the far right, you'll see 4 weeks there. You'll see a little blue line and a little yellow line. And that little blue line is lower than all the rest of the blue line all the way across. Likewise for the yellow line. So things are starting to settle down for us in terms of lower anxiety and lower depression. Still high levels, but starting to settle down. So here we're looking at data that's not statewide. This is regional, and it's not just Mason County. It's Mason County and surrounding counties. You got Cowlitz, Grace Harbor, Lewis, Pacific, Thurston, and Wahkiakum in here also. And if you look at, and so this is measured by emergency department visits. And psychological distress is really panic and high anxiety. That's what that measures. So if you look at the horizontal lines on the graph, not all the squigglies, but the horizontal blue line, that's 2020, and the horizontal orange line, that's 2019, it might look to you as if there was more psychological distress in 2019. But what really happened was the pandemic hit in March of 2020 and people quit going to the emergency department. So it's really hard to tell. The black line is where we are in 2021. If you can sort of imagine a trend line in black for those black squiggles, we can guess and hope that it might have a downward slope. Right now it does have a downward slope, just looking at it. Suicidal ideation, same thing. You can see that one's, if you look at the black line relative to the others, it's got a lower, it's lower on the graph. So that's a good thing. The other thing you could look at is the tip of the black line, which is where we were, I think 2 weeks ago. And you compare it to the blue line and the orange line, just the tip, then we are below where we were for this week in 2019 and for this week in 2020. So that's a good thing. Suspected suicide attempts, kind of the same thing. If you look at the tip of this black line here, it is below the blue line and the orange line. So we are below where we were in 2019, 2020 for suicide attempts in that cluster of counties of which Mason is a part. Suspected overdoses, same thing. Look at the tip of the black line. We're lower than the orange and the blue. So we're doing better. Alcohol-related ED visits, these are same thing. And you can look at, so not only is the tip well below actually the blue and the orange line, but the trend line of the black, you can easily see that the trend line is going to be lower than the other two. So that's good news. I'm trying to point out the good news when I can. So social and workplace considerations. Let's see, if you remember back on the graph, let me go back to that a second. We've got two recovery paths that are diverging. And one concern we have is that the folks that are more or less on the yellow line here are going to celebrate, be happy, and lose empathy for those that are really struggling down on that line. So we do have concern about that. We're still dealing with emotional regulation problems and impulsivity. I'm going to talk about that more on this slide. So the title of this one is Considering a Perfect Storm, maybe. So let's consider this. Whatever viewpoints we have on pandemic-related issues like masking, vaccinating, so forth, we're pretty certain that we're correct. And we're pretty certain that people that differ with us are either uninformed or misinformed. So we've got strong views and we've got polarized views. So you add to that that we have this impulsivity and emotional dysregulation. We have a harder time controlling our emotional responses. And you add to that that we're re-entering the social and the work worlds. So we're going to be interacting directly with people under these conditions where we're absolutely sure we're right and they're wrong, and we're more impulsive than usual. So this leads to, well, I'll give you an example of this. I've been following the what the airline industry calls, I think they call it the airline disruption incidents. These are the incidents in which they've got a passenger that's unruly, that will not comply, and they have to land the plane, and the police come on and carry this person off. So the airline industry tracked these incidents for 2017 through 19, and we had 130 average a year of these incidents. In the first 6 months of this year, 2021, we've had 3,000 of these incidents. And 76% of those have to do with complying with masking regulations. So this is exactly the kind of thing we're worried about, that we're so sure we're right, and we're fairly impulsive, and we're in contact with people. And if that airline disruption, if those airline disruption numbers are any indication, some people feel strongly enough that they're willing to fight about their views. So we are worried about that. Is there good news? Yes, there is good news. Resilience, the ability to bounce back in a disaster, it doesn't mean that you're not affected by the disaster. Everybody's affected by the disaster. But the more resilient you are, the more you can bounce back from it. And resilience can be taught, can be learned. The Department of Health offers trainings on this. And when I'm wearing my Red Cross hat, we offer trainings on this also. I won't spend much time on this, but these are components of resilience right here: connections, purpose, the ability to be flexible, and hope. And of these, probably the biggest bang for the buck is connections, social connections, reaching out to people that you can be honest with, that can be honest with you. And I think that's because if you have people like that, you're not just establishing a connection with them, but you've also got respect, trust, trustworthiness. You've got a basket full of really valuable qualities there. I think that's why that one is such a big bang for the buck. But all of those are important there. But I guess in summary, what I would say is that we still are worried about this impulsivity as we open up and go interact with more and more people. There are some worries about kids going back to full-time school. I mean, we think they should be going back to full-time school under safe conditions. But I also expect that there'll be some anxiety, some school refusal that we'll have to deal with back then. But I would say my take-home message here is the need has never been greater for us to show patience, kindness, tolerance, and please pause before you react and think before you say anything. So that would be me, and I'm done.
Well, thank you very much, Dr. Hudgins. Again, that's Dr. Ren Hudgens from the Behavioral Health Strike Team for the Department of Health. Scott Lindquist is going to come up next and talk with us. He too from the Department of Health.
So they should be able to see me. Yeah, I can kind of tip a little bit. Sorry, you can see me. Hi, so I'm here in person today. I was online yesterday, but I'm Scott Lindquist. I'm what's called a state epidemiologist. So I'm an infectious disease doc. I work for DOH. And let me just say, this has been a very long journey. It was my team that diagnosed the very first case of COVID in the United States. That was here in Washington State on January 19th. So there's nobody that's been at this longer than us here in Washington State. And from that, I am not burned out. I am not overwhelmed with this. And I think a lot of these principles Dr. Hudgins just talked about have been the success for myself. I've seen a lot of people really be stressed or quit or really decompensate. So all those principles we talked about with Dr. Hudgins, those are incredibly important. And in my experience since January when this began, that has been the secret to success. And I do think, I still practice medicine. So I work for one of the local tribes. I'm actually from Kitsap County. And I've been doing that through this whole pandemic, which has really grounded me well in what our provider community is experiencing with COVID. And let me just give you an example of a phone call that I had. And it feels odd speaking to the computer because there are people in here. So I will occasionally break away and say hi. But driving down here, I got a call from the clinic, and a 24-year-old woman from the tribe who had been vaccinated probably about 3 months ago was now sick, very ill, like going to the hospital kind of ill with flu-like symptoms, no energy, was confused, high fever. And they tested her and she's positive for COVID. Now, how can this happen? And so I want to talk about a couple things here. These vaccines are not 100%. So let's say they're 90%. That's kind of the number we use. Even with 90%, that means 10% of the people are going to get sick and get COVID despite getting vaccinated. Or the concern is this a different strain? Is this a new strain, which is so much more aggressive that this is happening? And who is watching for this? So I'm here to tell you that's what my office does. We look at all the strains since the very beginning of time. The initial COVID strains, viruses, just for a little bit of virus history here, viruses are not living things, okay? They aren't like bacteria. They don't live on your cells. They are just protein pockets that have directions to make copy of itself if it gets inside a human cell or a mammalian cell. And then it hijacks your machinery to make copies of itself. It's not smart. It doesn't decide, well, I'm going to create this variant or this variant. It just makes millions of different variations. And the variations that have an advantage will go on to become more predominant. So in the very beginning, we had a lot of different strains coming out. What has happened to date right now is that we have 3 variants that are running the show. The first one was this B117, or the names are changing, so I'm going to give you all 3 of them. It was the UK strain, which is also called B117, which is also called the Alpha strain. That was predicted to be a Mount St. Helens eruption in Washington. It was going to create a huge surge in cases. And while we did get a lot of these, over 50% of all our COVID cases are this Alpha variant. That is starting to fall. It's becoming less than 40% right now because 2 other strains are out competing it. And those 2 other strains are out competing it because they're more infectious. And one of them is called the Gamma strain or the P1 strain or the Brazil strain. That's all the same thing. And it has mutations on the surface that allow it to be more infectious. I am very concerned about this Gamma strain because it has higher hospitalization rates, it has higher death rates, and it was starting to rise as B117 or the Alpha strain was decreasing. But what has happened since then, as of our most recent report yesterday, is the Delta strain has now become the predominant strain. It's starting to outcompete the other 2 strains that I already talked about. And the Delta strain is a concern because worldwide you're hearing lots of media about how dangerous it is, how it's the predominant strain in other countries, how bad this is going to be for Washington. But the fact of it here in Washington is, while it may be increasing, it's about 27% of all our strains as of today, it is not giving us a big bump in cases. You saw Dave Windom presented the numbers. We're actually on a decrease in cases. So I don't want the discussion about Delta to completely freak us out, because we aren't seeing increases in cases. We are seeing a bigger percent of our cases being Delta, but the hospitalization rates and the death rates are not higher than the average. So for some reason in Washington, while we're seeing this Delta become more prominent, it isn't impacting our numbers or our severity yet. So we're watching this very closely. Washington is one of these, the top 3 states. We send about 30% of our isolates, our positives, for genotyping, so we can tell what variant it is. So this woman that I was talking about earlier, in the phone call here, what I said is, well, she is sicker than she should be. Most people that are vaccinated have a mild case if they get it. So it could be breakthrough, you know, the 10% that didn't take to the vaccine, or this could be a variant. This could be a new variant. It could be a more aggressive variant. So I asked the team that this lady gets tested at the University of Washington. I will get that strain and do a genotype analysis to see, are we having outbreaks like this that are now showing us what the Delta variant could do? So I'm going into such detail about this because I want you to understand the safety net behind a lot of what we hear in the media or what's happening in the community is actually being followed very closely. This is the last thing I think about when I go to bed at night, and it's the first thing I think about when I get up in the morning. So there you go. By the way, I sleep very good at night. I don't stay up all night. I get a good 8 hours. So with that, I'll save. I don't want to go into a lot more detail. I want to have time for the other speakers, but I'm certainly here to answer questions in person if anybody has them, or we can address the online questions too. So with that, I'll turn it back to you.
Thank you, Scott Lindquist, again from Washington State Department of Health. Moving now, we're going to listen to from Peninsula Community Health Services, Lynette Bird, the Clinical Operations Director, to talk a little bit on the vaccinations.
Hi, guys. Thanks for having me here. Just a quick introduction. For those of you who aren't familiar about who we are, Peninsula Community Health Services is a federally qualified health center. We provide primary medical, dental services, behavioral health counseling, substance use treatment. We have pharmacy services. Actually, our very, very first school-based health center is at the campus there at North Mason School. Yay. PCHS started vaccinating, I think, our staff and our first responders as soon as we got our hands on the vaccine. I think it was really that same day we received the Pfizer shipper. I think we were vaccinating that afternoon. And so that was probably mid-December. We were really fortunate. We've been really fortunate to work with great community partners, agencies, you know, that really have the same enthusiasm that we do, that we did with getting vaccines rolled out right away. Through all the partnership, we were able to quickly set up mass vaccination sites in Kitsap and Mason County. So thank you to North Mason School District, you know, for allowing us to use their space. Our Mason partners were so supportive, so engaged, you know, to be able to provide vaccines to the community, and especially the residents of Mason. You folks brought people to us, literally by busloads, you know, through all the collaboration, and really thanks to many of the volunteers that were on site. We successfully administered over 12,000 doses at the Mason mass vaccination site on Wednesdays. We've been able to actually provide some pop-up vaccine clinics throughout Mason County. Out of the 12,000 doses, there was 8,000, a little over 8,000 doses that were actually given to Mason County residents. And just a quick breakdown of the vaccine type, there was about 5,500 Pfizer, 2,400 Moderna, and then the rest were the Johnson & Johnson. So our plans are to continue with the pop-up vaccine clinics through the summer at least, around Mason. Right now for July, I think we're scheduled at the McClendon's parking lot once a week, I think Wednesday afternoons. We're actually offering vaccines to you. We'll come out to you if you can bring together at least 20 people who want to be vaccinated. We can assemble our vaccine outreach team. We'll show up at your doorstep. We'll show up at your party. We're available to do that. Just get a hold of us. You guys, there's no charge to this service. It's free. We'll be there. I think ultimately we want to be able to offer the vaccines in the clinics this fall. Our North Mason School-Based Health Center has vaccine for children available. We're currently working with multiple school districts right now, including North Mason, the nurse and some of the admin team to provide catch-up doses and some of the required immunizations for the kids. We're trying to get some kids ready for kindergarten and middle school for the fall. I think this fall, we're going to continue to work closely with our community partners. I think we're hoping to put together some mass flu vaccine clinics. And so I think there's more to come on that and more conversation. We really saw a success working together as a community, and we want to continue to do that. And that is it for me.
Awesome. Wonderful. Thank you so much again, Lynette Bird, the Clinical Operations Director there for Peninsula Community Health Services. We're really happy to be here in the auditorium, the lunchroom here at North Mason High School. And next up to talk is Superintendent for the North Mason Schools, Dana Rosenbach. Come on up here, Dana.
Yeah. Hi, thank you so much. One thing I want to just start off and say a big thank you for our partnership with Peninsula Community Health to provide vaccinations for our community members throughout the year. And we do plan to continue that partnership as we go into next year. And I have already scheduled, as Lynette was talking about, because I'm not sure you got all of that. We have already scheduled August 18th for a sports physical and vaccination catch-up clinic for our kids that will be available here on campus all afternoon from 3 to 7 p.m. So kids who don't have other vaccines other than COVID who are behind or that need a COVID vaccine and fit the requirements will be able to get those vaccinations that day, as well as we'll do sports physicals for kids so our kids are ready to go and getting back to school and back to the year like normal. We do have more significant requirements this year for all vaccines for kids, and we do not have the flexibility that we've had in past years, and this is just a coincidence. It's not a result of COVID. It was coming, but kids do have to be caught up on their vaccines to be in school and on the first day of school this year. And we've had more flexibility in prior years prior to COVID, but we don't have that now. So we're really glad that we have a partner that can help us work with our families. We've notified the families who need to do some catching up. It's fewer than 100 kids that need to do some catching up, but they will have the opportunity to do that. And then the kids that are in the right age group that want to get COVID, or kids that are getting ready for sports, will be able to come in and get their sports physicals done as well on that day to get ready for the fall, getting back to normal and getting back to school. And the good news is that we do get to be back in school. We are required to be back in school 5 days a week next year and full time. We'll still have some protocols for safety that we will be following. We will be continuing throughout the summer to maybe hear some updates from the Department of Health about exactly what those will be. We got our most recent update on Tuesday, July 6th, and that update basically says, for right now, until we hear something different, we will continue to have cleaning protocols in place. We will continue, and we are well prepared with our HVAC systems and ventilation systems throughout all of our schools. All of those requirements will be in place. We will try to do social distancing as much as possible and still get those kids in school and really keep focusing on cleanliness and hand washing. And for now, the requirements are these as far as masking, because I know that this is important to our families. Right now, what we know is this: kids and any adults who are in the buildings, when kids are in buildings, as of today, will be required to wear masks when kids are in the buildings. If we're in a school building like we are right now for this meeting and there are no children under 18 present and the adults who are present have had their vaccinations, then those adults don't have to wear masks. Adults who haven't been vaccinated still need to wear masks. Within our employee pool, we have a protocol in place to assure that we know who is required to wear a mask and who is not, and that they are following those protocols. So we will continue to do the protocols that we hear from the Department of Health. We'll continue to look forward to new information, and it may be different by the first day of school than it is today, but that's what I know today. I also want to emphasize that, like many districts around the state and all the districts in Mason County, we have received federal ESSER dollars. ESSER 1, 2, and 3 is the acronyms that we're using in the school district to describe the 3 different pots. When we got that first pot, as we were coming into school last year and having to switch on a dime and go to all remote learning, we used all of that money and some extra money we got from other partners as well to buy enough devices to be able to go one-to-one with our students. And that's a great thing, because we are going to be able to continue to be one-to-one and use what we learned in that remote setting to improve the learning environment for kids while they're in the building. And if we do have to go back to remote, if something happens for a short time, even for a snow day. So we have a lot that we've learned from this process. We used other dollars from those 2 pots of money to fill in the blanks from state funding that was taken back from schools during the crisis. And we're using the bulk of the newest dollars, the ESSER 3 dollars, for recovery for students. And we had very specific plans that we wrote that we turned into the state that were requirements from both the state and federal government for what that would look like. And we are planning to address the recovery of students, not just academically, but their social emotional health and their behavioral health as well. We looked at all of the data that we have, and we have considerable data on all 3 of those areas. One of the things that we have, for example, is a nationally normed assessment for social, emotional, and behavioral health called the SABRS tool. And we have done that regularly with our students for a few years now. And we were able to use that data and look at the data from previous years and really get a good handle on the impacts of our kids in social, emotional, and behavioral health from their experience in the remote learning and the stress caused by the COVID pandemic in their homes and in the community. And we're addressing those in our plans for next year. So there will be additional supports in the school day. There will be very targeted supports for kids in small groups and individually and as needed. We are looking at doing most of that in different ways within the school day, because in North Mason, getting to be able to do things with kids before and after school when transportation can be an issue for so many of our families, because so many of our families, both parents are working, and just that kind of outside of the school transportation kinds of things becomes difficult. So we are building most of the supports into the school day, but there will be additional after school and before school in the elementary school, extracurricular and tutoring and supports available to our families. We are building new supports in for our second language learning families and for other families in distress in a variety of ways across our district. And we're really proud of our team that we're putting that together with, and our partnerships with all the people in the community that help us do that. The counseling community, the faith community, other governmental agencies. We have amazing partnerships in North Mason that help us serve our kids. So we're looking forward to a really positive year. It'll be a very different year than it was last year. And it probably will be very different than what we've had before, because we've spent a lot of time figuring out what we can do better. And we're going to do those things better for kids. So that's what I got to say.
Thank you, Dana. Again, Dana Rosenbach, the superintendent here at the North Mason School District. Next up, we have a couple of representatives from Mason County PUD number 3. Lynn Eaton is the Communications and Government Relations Manager, and Diane Hennessy is the Customer Service Manager. And they're going to be talking a little bit with us about utility assistance and some funding opportunities. Lynn, Diane, are you there?
We are. Thank you, Jeff. So thank you, for the invite and letting us be a part of this panel. And And we just thank everybody there for being great community partners too. It's really makes our job a lot easier. We're lucky in Mason County to be served by 2 PUDs. You know, as a PUD, we're a not-for-profit, cost-based organization, and we're owned by the communities that we serve. And so being that, it really gives us a customer service focus. So our customer service manager, Diane Hennessy, is here sharing the screen with you, and she's going to talk about some of the help that's available to our customers. But we encourage folks who need help with their utility bills to visit pud3.org/help. But mostly just call our office, call and talk to one of our customer service representatives. They're all standing by ready to help. So with that, I'll turn it over to Diane.
All right, thank you. And can everybody hear me okay? Okay.
You sure can.
Oh, thank you. So, and I just want to say good evening and thank you for giving me the opportunity to talk about the resources available to our community. So our goal at PUD is to connect our customers with the help that is available today. I also wanted to thank the speakers over the last 2 days. They have given me some excellent information to take back to my team, my family, my friends. It's just been incredible. So big shout out to everybody. PUD, as you can see, works with many agencies. The list on this slide is not all inclusive. We encourage everyone, as Lynn said, to call customer service or visit our webpage so that we can get them connected to the best fit for their needs. At this time, though, I wanted to talk a little bit about some specific funds that have helped our community already and funds that are available now. So Community Action Council, which has been a great partner to PUD for decades, they have seen our community through some really tough times, but they have helped 610 households since October 1st of 2020, totaling $516,442. This is averaging $850 per household for energy assistance, which doesn't just include PUD 3. This includes PUD 1, wood, propane, oil, electric, Cascade natural gas. They also, at this time, have additional funding coming that will help with up to $2,500 in past due amounts. Actually, I want to correct that. It will actually pay up to current balances owing. So up to $2,500 if somebody owes that much. Please contact them. CAC is able to help low-income homeowners and renters. And then Crossroads Housing, I point that out about the homeowners and renters because Crossroads and Shelton Youth Connection is actually facilitating treasury funds that are helping renters. So this assistance is helping with rental, so back rent and forward rent and utilities. It is specific to tenants. However, landlords can help facilitate connecting Crossroads or Shelton Youth with their tenants. In fact, anybody can help connect people with help. So if you know somebody who needs help, please give them this information. A little bit about what they've done so far is Crossroads has helped 248 households for a total of $899,000. This has been through the ERAP funds and the TRAP funds. ERAP stands for the Eviction Rental Assistance Program, and that has ended, but the TRAP is available now, and that stands for the Treasury Rental Assistance Program. These are federal and Washington state government's response to the need for rental assistance due to the pandemic. So it is here to help. 178 households were funded through the ERAP, totaling $557,000. This funding has ended, oh, I already said that, sorry. And then the TRAP has already helped 70 households as of Tuesday with $343,000. They have 312 households still actively working on their paperwork. The reason I like to point out these numbers is these are real dollars and they're helping families get caught up. And that is what our community needs. So, and then my next slide is these are the efforts that PUD has been doing. So we are really trying to connect our customers with this funding. So as you can see, we've got all kinds of things going on. We've got door hangers we're doing, we've got emails we're doing, auto calls, text messaging, ad campaigns, billing inserts, personal phone calls from customer service reps. Our hope is to connect people with help so it frees up, no matter what kind of help they're doing, it's going to help them get caught up in all kinds of areas of their life. So if it's the rent, it's going to help them. If it's with their gas, it's going to help them. We just want to get them to the agencies to help. We know we're doing all this and we're connecting with all of our customers, and we know that everyone needs the help, but we can't always get to the people who do need it. So we're hoping for the help from the community. If they know somebody who needs help, just ask them to call us. It's really, really hard for people to ask for help, but now's the day and the time to do it. Our goal at PUD is to have 0 disconnects of residential customers when the pandemic is, or when the moratorium is over, but we need help doing that. We need communication. We need customers to call us and get on payment plans or to get to the help that is available. So Governor Inslee has made it clear that the moratorium is extended until September 30th. That is the last extension. So we are going to do everything we can until then to get people to the help agencies. So if you know somebody who needs help, please give them this information. Thank you. And if there's any questions.
Great. Thanks, Diane. Thanks, Lynn, as well. Finally, here, before we have some questions and answers, you can also ask into the chat, or if there's anybody here that has questions. Finally, from the Housing and Mental Health Program, the program coordinator, Todd Parker, is here.
Good evening, everyone. I'm Todd Parker, one of the employees with the Mason County Public Health Department. And I'm was asked to give a little bit of an overview on the Eviction Rent Assistance Program. So I'll give a little overview, talk a little bit about the accomplishments, kind of underscore some of the things that Diane said, also about the eligibility. And I really had 2 or 3 comments to think about here in the future. So before I really dive into that, I really just want to give a huge thank you to Crossroads Housing and Shelton Youth Connection. They're 2 community partners that we subcontracted with for rent assistance, for eviction rent assistance programs. And it's one of those things that I worked predominantly prior to the COVID-19 and the homeless crisis response system. And that's really where these agencies specialize, running shelters, some low income housing, rental assistance to move people from homelessness into housing so they have permanent housing and can achieve some housing stability. And so really they've had to shift massively as agencies into now eviction prevention programs. So, it's taken a lot for their staff to, shift duties, roles, we'll learn new programs, learn grants, the forms and doing everything right. And they've just done an amazing job. The other thing is both agencies in the last year have opened offices in Belfair. So while they were hubbed in Shelton, they now have satellite and really ongoing offices here in the Belfair community. So it's very exciting to see them grow and see them connecting with everyone throughout Mason County. Another thank you is to both the public utility districts 1 and 3. They've been both great to work with. Also, the Mason County Journal, they've run 2 stories on the eviction rent assistance and the opportunities and given some updates that way. And that's been great. Just in the last week's journal, in the nonprofit briefs, Crossroad had another announcement to contact them and reach out if you need assistance. And then the last group is just really anyone and everyone throughout the county that's connected people to these resources that are available. So a brief overview, the Eviction Rent Assistance Program grants are part of Washington State's response to the COVID-19 pandemic. Funds are intended to prevent evictions that would contribute to the spread of the virus by paying past due, current due, future rent, and utilities, targeting limited resources equitably to those who have experienced financial hardship due to COVID-19 outbreak and are at risk of experiencing homelessness or housing instability. I also kind of see it as, see our landlords as, a lot of small business owners and, well, some of them that operate lots of property, larger business owners. It's really keep them employed. So it's, helps tenants out, but it's also a great resource to help our landlords out so they can still continue to provide housing across the county. These programs have been operational since September of 2020. So in the past 10 months, a total of 295 households have been assisted. And just at the end of June here, we passed the $1 million mark in assistance paid. So that's been very, I thought a real big milestone there. But there's a lot more. There's just in the rental and utility assistance, there's probably another $1.5 million remaining. So there's a lot of assistance and supposedly more on the horizon too. Eligibility for the program is you must be a renter. So if you own your home or mortgage, there's other programs out there. That's not the area I work in. So it's really focused, these eviction rent assistance are for landlord-tenant relationships. Households need to have an area median income of less than 80%. So that, I can't just give you a number for that because that really depends on the household size. But our agencies have all the charts and can help you, depending on how many people are in your household, can tell you the qualification levels for that. With that is a prioritization. So we really prioritize households that are below a 50% area median income and households with one or more individuals who are unemployed and have been unemployed for 90 days prior to their application date. So just to give you an example is that 78% of all the households assisted are under 30% area median income. So, it's really the folks that have experienced some severe hardships, so economic hardships throughout this COVID pandemic. So finally, some thoughts for the future is the eviction moratorium bridge, proclamation 21-09 is effective 6 months. So this is a time for repayment plans to help folks get back on track with rent and utility. And so really the time is to act now. So number 1 point, act now. It's a finite timeline. The second one is just really work together. Communication is the key. There's, encourage that communication. It's kind of also asking for help. Just being willing to be vulnerable for a moment and say, hey, I need some help, or I need to work out a payment plan. So I know a lot of landlords are very open to try to figure things out, try to make things, workable. And we can assist, the agencies can assist. There's kind of worksheets to help with repayment plans. So again, not alone in those efforts. The other one, employers just really help, as far as working together and help spread the word of communication. So if you have employees, please inform them about the programs. We're happy to supply flyers, happy to come out to the workplace, even staff meetings, whatever it might take to educate people about these opportunities that are available to them. And then finally is make contact, act today to Crossroads Housing. Their specialty is households that are, if you're age 25 and older, and Shelton Youth Connection is really targeting on those that are households that are 18 to 24 years of age, and contact your public utility districts. All right, thank you.
Again, that was Todd Parker, Housing and Mental Health Program Coordinator for Mason County Public Health. I want to thank all the speakers throughout today and yesterday. We do have some time now for opportunities for questions. If anybody here has questions, or if any questions have come in the chat.
We have one.
Yes.
What documents should folks have ready to apply for funding assistance?
And that would be with Todd, probably.
Probably that or the utility.
Documents for funding assistance to have on hand. Todd, we can start with you. And then after Todd, if somebody from PUD wants to jump in on that.
I wish I had all that memorized. I mean, the primary one is your income. So, proof of or not, or if there's been any unemployment or anything like that. That's going to be the starting one. Those are some of the details that the agencies can work through and help assist you with all the paperwork. But that's a great question. I really appreciate, being proactive and seeing what is needed ahead of time.
I can jump in really quick if you like.
Yeah, please,
I
Diane.
reached out to a couple of agencies and they really encouraged you to call them to make sure that they didn't want us giving bad information. But as Todd said, payroll is a big one, proof of COVID effectiveness, and with the TRAP, the rental. But they are working with everybody, so please just reach out to them and ask.
Again, there are plenty of opportunities for information on the Mason County website. You can also go and learn more through the different services that Todd was talking about in his programs. North Mason has information about the upcoming school year, and Peninsula Community Health Services also has information upcoming on what is happening for vaccination clinics down the road. You can always get the latest COVID numbers for Mason County or the state through the Mason County Public Health Department at co.mason.wa.us. You can check in there with the links right at the top. And again, a big thanks to everybody that helped put this on today: the Mason County EDC, the North Mason School District, the Mason County proper, City of Shelton, and Peninsula Community Health Services and KMAS. If no one other questions there, none come through, none here tonight. Again, I appreciate this. This is going to be recorded, so folks will be able to share this out to other agencies and other interested parties. And again, thank you so much for having us talk to you a little bit about the future here in Mason County and beyond.